How does amblyopia affect the visual pathway? Imagine your brain as a busy city with roads connecting different areas. When you have amblyopia, or lazy, it's like some of those roads are blocked or less traveled, which affects how signals from your eye reach your brain. This condition mainly disrupts the normal development of the visual pathway by causing the brain to suppress signals from the affected eye. As a result, fewer neural connections are formed, and the brain processes less information from that eye. This suppression usually happens during early childhood when the brain is still learning how to interpret visual signals. If one eye sends weaker signals because of blurry vision or misalignment, the brain starts to favor the clearer, making the neural representation of the weaker eye weaker too. The visual pathway starts at the retina in the eye, where light is converted into electrical signals. These signals travel through the optic nerve to the optic chiasm, where some nerve fibers cross to the opposite side. From there, signals go to the lateral geniculate nucleus in the thalamus, which acts like a relay station, and then to the primary visual cortex in the brain's occipital lobe. In amblyopia, the weaker signals from the affected eye lead to fewer neural networks being dedicated to processing its input in the visual cortex. This means the brain doesn't fully develop the ability to interpret what that eye sees, even if the eye itself looks normal. Recent studies show that amblyopia affects different parts of the visual pathway in different ways. The on pathway, which is responsible for signaling light or bright stimuli, is more impacted than the off pathway, which signals dark or shadowed stimuli. This imbalance can cause individuals with amblyopia to have a bias toward perceiving darker images or shadows, and it also means their brain responds less to light features. This discovery challenges earlier beliefs that both pathways were equally affected and opens new avenues for targeted treatments that could focus on strengthening the on pathway. Beyond the basic visual signals, amblyopia also impacts higher-level functions like motion perception. When the brain tries to interpret movement, especially in noisy environments, people with amblyopia often struggle. This difficulty reflects dysfunction in areas beyond the primary visual cortex, such as the middle temporal area, which is crucial for processing motion. These higher-order deficits show that amblyopia isn't just about blurry vision, but also affects complex visual tasks that requiring integrating information over larger areas of the visual field. Clinically, treating amblyopia involves encouraging the brain to use the weaker more effectively. Common approaches include patching the stronger to force the brain to relying on the amblyopic eye or using eye drops like atropine to blur the vision in the stronger temporarily. These methods aim to promote neural plasticity, helping the brain rebuild and strengthen the connections related to the weaker. Treatment can take weeks or months and needs consistent effort to achieve meaningful improvement. In summary, amblyopia affects the visual pathway by suppressing signals from the affected at the neural level, especially impacting the light signaling on pathway more than the dark signaling off pathway. It also disrupts higher-level processes like motion perception, leading to long-term changes in how the brain processes visual information. Understanding these effects helps eye care professionals develop better treatment strategies to improve vision and preserve health. Always consult a healthcare professional for personalized advice and treatment options.